Hi, my name is Olivia Suter. This is my interview video assignment for my capstone Psychology 491 at Liberty University. For my interview, I talked to Alexa Tracy, who has her master's in social work and is a licensed social worker for the state of New Jersey. She currently works at the DeBoer Heart and Lung Center as a discharge planner in their ICU. For a discharge planner, they are in charge of getting patients discharged, but it goes beyond that. They are advocates, support systems for a patient's journey outside of the hospital. When a patient comes into the hospital, they are assigned a discharge planner that will help them with whatever it is that they need. During their stay, if they need certain treatments, Alexa will obtain the authorizations for them, so that way they're not paying out of pocket, but they can get the insurance to pay for them. Once they are set up for discharge, she will decide what course of plan of action is needed outside the hospital with the doctors. The doctors could say that they need additional support or they need additional support at home. Alexa can then set that up. She can set patients up with home health nurses, home care, different types of equipment that might be needed at home, or anything in that nature. She can also set patients up at facilities that are not hospitals, like additional rehab facilities, cardiac rehab, anything that the doctors think that they need that is outside of the hospital. On top of being all of that, she is a support person for all of the patients. When she goes into a patient's room, she is there to be whatever they need her to be. If that is just someone to talk to, she is there for them. She is there to support in any way she can. Another thing she can do is set up disability paperwork for patients. So if something were to happen in the hospital that they either need short-term or long-term disability, she can help a patient achieve that. She is also an advocate for her patients. She can go to them, see what they need and what the doctors aren't doing, and then she can go to the doctors and say, hey, this is what the patient needs. Can you please get this for them? Or this is what they're requesting. Can we see if we can do this? She has talked about how this job is very, very fulfilling for her. Her past jobs were not quite as fulfilling. They always seemed to be very draining and not as many success stories as she achieves now. She now gets to see quality of life improve, or she gets to, in some very rare occasions, save lives by advocating for her patients. With the quality of life she is setting up for them, she's advocating for mental health consults, she's advocating for anything that the patients might need in their everyday life once they leave, and she's able to give them that, which gives her more fulfillment than she had in previous places, because it is a first-hand gratitude from these patients saying, thank you for getting that for me. In her day-to-day work, she gets to sit and talk with these patients face-to-face. She gets to build rapport with them and really get to know their life stories. Even if it's just for a short period of time, she really gets to know these patients and know what all of their wants and needs are. Sometimes, in her case, she gets to help patients die the way that they want to. If the patient says, hey, don't let them do CPR on me anymore, this is not what I want, this is not the quality of life I want, she gets to help them do the paperwork and get them set up for informed, educated decisions that the patient's made, and she gets to advocate on their behalf. Even if the doctors are like, no, this is fine, we can fix it this time, the patients can be like, no, and she will back them up 100%. The one thing she found the most challenging about this work was that it is very draining. Everything is draining when it comes to social work, because there's just such a need to put yourself into patients and give your all to patients, and that can be very draining. She loves having to figure out all of the puzzle pieces that go with finding the patients a good discharge plan, and getting them set up for home or getting them set up in a new care facility. So lots of challenges come to networking and getting everything set up. She loves to also chip away at the system, which can also be very challenging because the hospital system is not designed for mental health and the invisible illnesses that can plague a patient. But she knows, as a social worker and all of the other things that come with knowing much more about mental health than we have in the past, that mental health is very important. And just because it may not be present all the time doesn't mean it's not present. So she is a big advocate about chipping away at the system and recognizing mental health in these patients and getting them help that they need. There is a lot of battles when it comes to taking care of these patients and dealing with the doctors, because they are very much set in their ways, and just because their way worked one time does not mean it always works. And she tries to always advocate for her patients and say, hey, maybe we should try this, maybe we should do this. She really does go above and beyond to help her patients, which is very challenging, very draining, because she needs to put in just to one patient, she's putting into an entire unit of patients. For her professional growth, she continues to do lots of trainings, whether or not the hospital pays for them or says, hey, you should do this training. She's always seeking new trainings. She's also always going above and beyond for her CEUs. When she does her CEUs, she always tries to find additional classes she might take or additional knowledge that she could find, just to help her continually advance her knowledge in her career. When she gets a hold of a resource, whether or not it's another care facility or a rehab center, she always tries to ask them, like, hey, what are your resources, to build her resource knowledge to be able to have more resources to give to patients. The more she has, the more she can offer these patients, the better off that they will be. With that, she does a lot of self-research to find all these sources that are around her and really get to know her area, so that way she can better support patients. When she does her own research too, she's trying to find new ways that people are, treating mental health or treating hospital patients and their stays, and just different types of things that affect her day-to-day work. When she finds these new ways and trainings and things that have worked, she tries to go to doctors and see, like, hey, is this something we can implement? Is this something we can try? She's always trying to find new things that can make the system better. Her advice to students were to make sure you have everything together before you enter this system. This is not a job that people should join for money or for, any other reason than to know that you are going to be drained by helping other people. You have to know how to take care of yourself. You have to know how to compartmentalize. You have to know what your stress is and how to handle it, because you have to be that for other people. You can't be that if you don't know how to support yourself and how to take care of yourself. For her, she gets frazzled very easily, and she knows this, so she has ways to stay organized. She plans ahead. She tries to have all of her ducks in a row, so that way she does not get frazzled as easily as she did before. Be mindful of shared trauma. Just because you have your own stress and everything else, these patients have their own stress. They have their own traumas, and it can be very hard to not take that trauma home with you and carry it as a burden. Do your best to leave work at work. And maintain a good mental space, because it is very hard to help people when you don't know how to help yourself. And that is my interview for Alexa Tracy, who is an MSW, LSW. Thank you.